Namaste. Good afternoon, everyone. Dignitaries on dais. I am highly honored to be here in front of you. When I was invited to be here and to deliver a lecture on certain diseases, I was apprehensive, and at the same time I had no idea how it will be like to speak about some diseases in a conference of this caliber, and where the discussions will be about creation, about good things. But as I was invited, so I agreed to come here, and I'll be speaking on urinary tract infection. I want to know, do you have any idea that females most commonly suffer from which disease? No. The disease itself speaks. The name itself speaks for itself. Common cold. Common cold. Sorry, Loka. This is the number one disease suffered by male, female both. The second most common disease suffered by female. Every one of you will be having that problem in some time or the other. Low back pain, coccygeal beak. So I think everyone have the experience of developing the low back pain, coccygeal beak in some time or the other. The third most common disease suffered by female is urinary tract infection. Commonly, it is called as Prasab Jala Purakar. So we used to get so many females, and it involves females of all age group, and those females who are active like you, and those people who will be working outdoors, the sports person, all those who needs to do hard work and work for long hours, unable to take much water, will be prone to develop urinary tract infection. So what is UTI? It is the infection of any part of the urinary system. The urinary system starts from kidney, the ureter, urinary bladder, and urethra in female. So infection in any of this part is called urinary tract infection. Why females are more prone to urinary tract infection? Because the urethra in female is short. It is only 3 centimeter. In males, it is 20 centimeter. So infection from outside cannot go easily in case of male, but in female, because urethra is very short and the perineum where the urethra opens to outside is an area where it is very close to the anus. পায়খানা রাস্তার একেবারে উচৰত থাকে। গতিকে infection is very common and females are prone to develop. If she has some kind of diseases, maybe diabetes where immunity goes down, pregnancy where immunity goes down, postmenopausal women, after the monthly cycle stops, the area becomes very prone to get infected. The defense of that local area goes down. The urethra becomes very stiff rather than elastic kind of structure. After menopause, it becomes very stiff, and the epithelium becomes unhealthy, so prone to urinary tract infection. Sexually active females, they are more prone to develop because of the external genital area, the vaginal area is very close to urethra, and during sexual intercourse the urethra gets some minor trauma, and in that area the infection occurs. So again, there are some habits. I cannot say it is bad habit, because sometimes because of the unaccustomed circumstances or unhealthy atmosphere, the females used to hold urine for long, and that gives the extra time for the microorganisms to enter into the bladder. Once it goes into the bladder, it will stick to the bladder, and then infection occurs, and after the next day you will feel the burning frequency, then passing urine again and again. So you have to do something so that you can pass urine when you feel the urge to pass urine. Do not postpone it. And some of the females, do like while going outside, because she may not get favorable atmosphere or the bathroom maybe in that area, what she will do, she will consciously take less water. That will again cause less urine formation. Urine flushes the bacteria while passing. So if you form less urine because you are consuming less water, urine formation will be less, and your natural flushing mechanism again will be hampered. So take more water and do not postpone urination. That is the message. So infection most commonly occur in the urinary bladder, and the symptoms I will come in next few lines. And the kidney infection, which is less but it is serious. In diabetic females, they are more prone to develop kidney infection. Then the urethra, the symptoms are almost similar with infection in the urinary bladder. So symptoms will be burning, frequent urination. You have to pass urine again and again. When you go past, again you will feel like, again I want to go. Urgency, once you feel the urge, you cannot stop. Then pain, when there is infection in the kidney, you will feel the pain in the flank area. Fever or blood in urination, pain in the back. These are all infection, and it is kind of little serious. So that signifies kidney infection. Again, those who are at risk, কোনে বেছিকে ডেভেলপ কৰিব এনেকুৱা ধৰণৰ ইনফেকশ্যনবিলাক, যোনে পানী কমকৈ খায়, প্ৰস্ৰাৱটো বহুত দেৰি ৰাখি থাকে, সেক্সুৱেলি এক্টিভ ফিমেল, ডায়েবেটিছ, মেনোপজ, দোজ সাফাৰিং ফ্ৰম tuberculosis and pregnancy. These are the category of people who are prone to develop urinary tract infection. So once the germ enters, once the bacteria enters into the bladder, it sticks to that epithelium, and the symptoms comes. And there are some habits. Those who do not use water after passing stool, some of the females, they used to take toilet paper. So if they use the paper from back side to front side, that again leads to infection. So my advice is to use the toilet paper from front to back, not reverse. And after physical relationship, sexual intercourse, make it a point to pass urine. If you do not pass urine after intercourse, chances are that you are prone to develop urinary tract infection. Some of the people, most of the time, when I sit in the OPD every day, if I see 50 patients, 5 to 10 female patients will come that I get repeated urinary infection. So 2 or more infection in 6 months, 3 or more in 12 months. Samahot jodi দুবার ইনফেকশন হয়েছে, বছৰত যদি 3বার বা 4বার হয়েছে, this is called recurrent urinary infection. So it relapses. If we do not treat the cause, if you do not change your habit of taking urination or passing urine, or passing urine after intercourse, then the things will again be recurrent. So the infection in the bladder is easy to treat. If it passes to the kidney, it becomes difficult. In that case, we need IV antibiotics, hospitalization, IV fluids. If the sugar is high, we need to control the sugar. So simple urine test, urine culture, ultrasound helps to diagnose the case. Treatment, we give antibiotic, plenty of water. If required, painkiller, not regularly but SOS basis. My advice, if you take antibiotic, take the full course. Even if the symptoms subsides, you feel better, still you completely continue the antibiotic course. Do not stop in between. Or when you start again, do not start the antibiotic which you stopped earlier. So a full course is advisable, or else the infection will become resistant. And avoid self-treatment, see a doctor. So what not to do, I have already told. The tips: take more water, 2 to 3 liters of water, and empty bladder frequently after intercourse, and use cotton underwear. So the antibiotics, I'm not going to details because time is less. And pregnant female, yes, again more prone to develop. If pregnant female develops the infection, immediately go to a doctor, because if we do not give treatment at the proper time, then the kidney infection will be there. In that case, it will be difficult for the mother and the baby at the same time. Lifestyle modification is required. If the recurrent infection is there, in that case, if someone is taking some tobacco, alcohol, carbonated drinks, should be stopped. So very common in women, because as I have already told, this is the third most common disease suffered by female. And if we see person to person, a female in her lifetime will at least have 3 episodes of established urinary tract infection in her lifetime. So it's a common disease, you should know about it. And early treatment is very, very simple, but if we do not treat or we postpone it, it becomes sometimes chronic, and at the same time there may be infection in the kidneys which will be difficult to treat. Prevention is easy, and seek help early. Thank you for the patient hearing, and I feel we were not bored to hear about some scary disease, but as a healthcare professional, I feel that I should scare you so that you take help. And I wish all you remain healthy and contribute for the growth of the society, growth of the country. Namaste.